Hello, my name is Jacqueline Kent. I work at the University of Western Australia with the Hartman Human Lactation Research Group. I've been there for 33 years, and during that time I've become passionate about breastfeeding. Today I'm talking about very much objective measurement of lactation parameters. So every other biological function we have, we don't just look at ourselves, the doctor doesn't just look at us and say, I think you're okay. We measure. So if we're concerned about blood pressure, we immediately put a cuff on and we measure the blood pressure and we compare that to a reference range. So if we are within the reference range, we are happy. If we're not in the reference range, then we find out what is wrong and we do something about it. I think the same should apply to lactation. And my particular interest is breastfeeding parameters. So for breastfeeding mothers, how often should they or do they feed their infants? How long does the infant spend at the breast each time? Especially how much milk is transferred each time and how much milk is transferred for the whole day. And we get an objective measure and then we can compare it to a reference range. They really lack confidence in what their baby is doing because their breasts don't have a little kettle gauge to say whether the breasts are full or being emptied, how much is going out. The babies don't have a little stomach kettle gauge. They don't know how much is going in. They don't know when the stomach is empty. So if the baby is crying, is it because it's tired, it's got wind, it's got gas, because the tummy is empty? The mother doesn't know. So she can really lose confidence and think that the baby's crying because she doesn't have enough milk. If we do an objective measure, then we can see that the baby has or has not taken milk, and then she can hopefully have more confidence that her milk supply is okay and the baby is crying for another reason. Or as a diagnostic tool, she can find that the baby, although was latched on correctly, seemed to be sucking, seemed to be swallowing, but actually hadn't transferred any milk, then we need to do something about that. It's a procedure called the 24-hour milk profile, breastfeeding milk profile. So we send mothers home with an accurate integrating baby weight scale. The mothers can then do the weights in the stress-free environment of their own homes, so they don't have any health professional looking at them and making them feel uncomfortable. We try to make it as easy as possible for the mothers, and to enter their data, they can use a smartphone linked to a website, a secure website. They can just simply choose whether it's a breastfeed, or we also measure expressions, we also measure supplementary feeds. So if it's a breastfeed, they just click on their phone for breastfeed. They then choose whether it's the left or the right breast, enter the weight of the baby before the feed the baby, don't change any clothing or nappies, weigh the baby again after the feed, put those two weights. So they do this every feed for 24 hours. The data comes through to a website, we check the data, and then at a push of a button we can generate a report. And that report says how many times the baby went to the left breast, how many to the right, so the total number of breastfeeds for the day, how long the baby was at each breast each time, and you get an average duration of each breastfeed. You get the amount of milk that the baby transferred at each feed, so you get an average transfer at each feed, and then you get a total milk production. And there's also a little graph that gives a pictorial image of what the baby has been doing. So the frequency of the feeds, the duration of the feeds, and the amount transferred. And it helps to emphasize to the mothers that there are some small feeds, there are some large feeds, that one test weigh will not tell how much is being transferred for the whole day. We checked that they were doing well by looking at their growth curves on the World Health Organization growth centiles. So we made sure we had data from babies who were growing between the 3rd and this 97th centile on those growth charts, and that they were maintaining their trajectory. Now on the health charts, on the growth charts, you see that there's a huge range in the rate at which babies grow. Some babies grow at a slower rate, some babies grow at a faster rate. So with those babies that are growing at different rates, we also looked at their breastfeeding parameters. Some babies feed only 5 breastfeeding sessions a day. Some will take up to 13 breastfeeding sessions a day. Sometimes the babies will dine and dash. They'll have a very short 5-6 minute breastfeeding session. Others like to linger over their meals. They're the mother's cafe, open all hours, come as many times as you like, take 1, 2 or 3 courses each meal, and stay as long as you like. The message for health professionals is don't try to force every mother and baby to be average. Allow them to be individuals so that they can, if a baby is feeding a few times a day but getting adequate milk intake, don't force them to have more feeds in a day. If a baby is one who grazes, has lots of breastfeeds every day, don't try to say you must reduce your breastfeeding. And whatever you do, don't say that the baby should be sleeping overnight, because babies up to 6 months old, 66% of babies are still breastfeeding at night. That night feed or those night feeds are normal, and for those night feeds the babies take 20% of their total intake during that nighttime period. So when mums are feeding at 2 or 3 in the morning, please be reassured that there are lots of other mums who are also feeding. Just about every mother feels guilty, and any behaviour of the baby that they think is not normal, they blame themselves. I would say, come, get some scales, do a 24-hour milk profile. We'll see exactly what you and your baby are doing. We'll compare that with a reference range. If everything else is going well, you're going well, you don't need to do anything about it. The data that we have from the 146 participants we've had so far would suggest that if the baby is transferring less than 550 mils a day, I would be concerned. I would really get a doctor to check out that that baby is growing properly. If there's any concern, I would try to get that milk production to come up a little bit, and that I leave to the lactation consultant, whether the mum needs to pump a bit more to increase her milk supply, whether she needs to introduce an extra feed. There might be too long a gap in between feeds. She might need to do something else to increase her milk supply, like often the adjustment of the positioning and attachment can make the milk transfer be more effective. So if the outcome is less than 550 mils a day, I would ask a clinician to investigate that baby carefully.